Welcome to this comprehensive journey into the world of cardiology, the science of the heart. In the next hour and a half, we'll explore how the heart works, what happens when things go wrong, and how specialists diagnose and treat heart diseases, anatomy and physiology, heart location and structure, chambers and valves, electrical conduction system, blood flow, systemic vs pulmonary. The human heart is a fist-sized muscle located just left of the center of the chest. It has 4 chambers and beats more than 100,000 times a day. Anatomy: CE, common heart diseases, coronary artery disease, CAD, heart failure, arrhythmias of this, VT, etc. Valvular diseases, congenital heart defects. Coronary artery disease is the most common type of heart disease. It occurs when the blood vessels that supply your heart become narrowed. Symptoms and warning signs. Never ignore symptoms like chest pain, shortness of breath, or dizziness. These could be warning signs of serious cardiac issue: chest pain, palpitations, fatigue, fainting. Diagnostic tools: ECG, EKG, echocardiogram, cardiac catheterization, blood tests. Treatment: medications, beta blockers, statins. Lifestyle changes, surgical options: bypass, stents, valve replacement, emergency management, CPR, defibrillator prevention, and heart health tips. 80 of heart disease is preventable with simple lifestyle changes. Here's what you can do today: healthy diet, exercise, no smoking, manage stress, regular checkups. Cardiology is more than treating disease, it's about protecting life itself. If you enjoyed this video, make sure to subscribe, leave a like, and share this with someone who might benefit. Visual: an animated beating heart along with your channel logo. Medical Search Hub appears on screen. The website URL medicalsearchhub.com is displayed prominently. Voiceover: welcome to Medical Search Hub, your go-to destination for exploring medical science and advancing your knowledge. Visit us at medicalsearchhub.com. Today, we're bringing you a comprehensive guide to cardiology, covering heart diseases and the diverse specialties within cardiology. Stay tuned. 1. What is cardiology? 7 minutes. Content points. Definition: cardiology is the medical specialty dedicated to diagnosing, preventing, and treating disorders of the heart and blood vessels. Scope: this field covers everything from preventive care to acute management and chronic treatment. Roles of a cardiologist: they work in general cardiology, interventional procedures, electrophysiology, echocardiography, heart failure and transplant care, congenital heart disease, and even preventive and geriatric cardiology. Visuals: clips of cardiology clinics, doctors using ECG machines, and patient consultations. Voiceover: in cardiology, specialists not only diagnose and treat common conditions like coronary artery disease and arrhythmias, but also focus on the prevention of heart disorders through lifestyle modifications and early screening. 2. Anatomy and physiology of the heart. 12 minutes. Content points, location and structure. The heart is located slightly left of the center in the chest. Behind the sternum, it consists of 4 chambers and several key valves. Electrical system: discuss the SA node, AV node, and the heart's conduction pathways that control its rhythm, with a brief introduction to ECG tracings. Circulation: explain the difference between the pulmonary and systemic circulatory systems. Visuals: animated diagrams showing the heart's chambers, valves, and electrical conduction. 3D models and ECG waveforms. Voiceover: understanding the structure and function of the heart is crucial, as its complex anatomy underpins all aspects of cardiovascular health and disease. 3. Heart disease overview and statistics. 10 minutes. Content points. Definition: cardiovascular diseases (CVDs) include a wide range of heart disorders, often the leading cause of death globally. Prevalence: highlight key statistics. For example, heart disease is the #1 killer worldwide, with significant trends showing a decline in heart attack deaths over the past 50 years, but a rise in heart failure and arrhythmias. Global impact: briefly discuss the burden of cardiovascular disease worldwide with visual charts, voiceover. Despite tremendous advances in medical care, heart disease remains a major public health challenge. These statistics remind us of the importance of prevention and early intervention. For common heart diseases, 18 minutes content points. Coronary artery disease (CAD). Describe how plaque buildup leads to narrowed arteries, risk factors, and symptoms, heart failure and cardiomyopathies. Discuss the weakened heart muscle and how it struggles to pump blood effectively, arrhythmias. Introduce types such as atrial fibrillation and ventricular tachycardia, stressing the importance of rhythm regulation, valvular diseases. Explain conditions involving stenosis, narrowing or regurgitation, leakage of heart valves, congenital heart defects. Briefly outline common congenital conditions like atrial septal defect (ASD) or ventricular septal defect (VSD). Visuals. Case examples, animated sequences explaining the disease mechanisms, and statistics overlays voiceover. Each of these conditions affects the heart in different ways, and early detection can make a life-saving difference. 5. Symptoms and when to act. 6 minutes content points. Warning signs: chest pain, shortness of breath, palpitations, severe fatigue, and fainting spells. Action steps: if you experience unusual chest pain or a rapid and irregular heartbeat, seek medical help immediately. Advice: provide simple guidelines on staying calm, resting, and contacting emergency services as needed. Visuals, text overlays listing symptoms, infographics demonstrating do's and don'ts during a cardiac event. Voiceover. Recognizing early symptoms and acting immediately can be crucial in preventing a serious cardiac event. 6. Diagnostic tools. 12 minutes content points. Electrocardiogram, ECG, EKG. Basics and how to interpret simple tracings, echocardiography, use of ultrasound to visualize heart structures and motion, stress testing, explanation of treadmill or pharmacological stress tests, cardiac catheterization, how it's used to evaluate the coronary arteries, advanced imaging, a quick overview of cardiac MRI and CT scans, visuals, clips of diagnostic procedures in a clinical setting, animated illustrations showing how each tool works. Voiceover. Modern technology has revolutionized the way we diagnose heart conditions, enabling precise assessments and tailored treatment strategies. Treatments and interventions content points, lifestyle modifications, diet changes, regular exercise, smoking cessation, and stress management medications, common drugs like beta blockers, statins, and ACE inhibitors, interventional procedures, an overview of angioplasty, stenting, and other catheter-based interventions, devices, the use of pacemakers and defibrillators, surgical options, valve repair or replacement, coronary artery bypass, grafted cath, and heart transplant, emergency care, quick tips on CPR and first aid measures, visuals, procedure animations, patient testimonials, and real-life case studies, graphical breakdowns of treatment options. Voiceover. Treatment of heart diseases relies on a blend of lifestyle strategies, medications, cutting-edge interventions, and sometimes surgery, each tailored to the patient's needs. Cardiology subspecialties content points. Introduce and explain each subspecialty with details on roles, typical procedures, and training paths. General cardiologist manages routine cardiac care, diagnosis, and preventive measures. Interventional cardiologist performs minimally invasive procedures such as angioplasty and stent placement. Electrophysiologist specializes in diagnosing and treating heart rhythm disorders, including pacemaker and ablation procedures. Echocardiologist focuses on advanced imaging and interpretation of echocardiograms. Heart failure or transplant cardiologist deals with advanced heart failure management and heart transplant procedures. Congenital cardiologist treats patients with congenital heart defects in both children and adults. Preventive cardiologist emphasizes risk reduction through lifestyle changes and early screening. Geriatric cardiologist specializes in managing heart diseases in the elderly. Sports cardiologist addresses the unique heart health issues of athletes and active individuals. Cardio-oncologist monitors and manages the cardiovascular side effects of cancer treatments. For each specialty, include short clips or slides showing a doctor at work, training environments, or case studies. Use text overlays to name each specialty and list key functions. Each subspecialty in cardiology plays a vital role. For example, interventional cardiology focuses on catheter-based treatment, while electrophysiology is all about correcting arrhythmias. Path to becoming a cardiologist. Content points. Educational requirements. Medical school followed by an internal medicine residency, usually 3 years. Fellowship training. A dedicated cardiology fellowship lasting 3 years, with additional subspecialty training available for 1 to 2 years. Certification. Requirements for board certification and ongoing education. A timeline graphic displaying the typical career path. Quotes from established cardiologists or training institutions. The journey to becoming a cardiologist is long but rewarding, requiring years of rigorous training and a passion for saving lives.